Hello, I'm Dr. Marla Shapiro. I sit on the Board of Trustees of the International Menopause Society, and today I'm thrilled to be joined by Dr. Susan Goldstein. Sue's from the University of Toronto. Susan, can you introduce yourself to our audience?
Thanks, Dr. Shapiro. Thank you for having me. Yes, I am Susan Goldstein. I am a family physician here in Toronto. I am an assistant professor in the Department of Community and Family Medicine at the University of Toronto. And my background is in faculty development, curriculum development, medical education, and with special interests in mental health and women's health. I am an NAM certified menopause practitioner. However, I do practice primary care. And I also sit on the board of directors of the Canadian Menopause Society.
Well, today we're going to be talking about a simple approach to menopause management. So firstly, let's start out about how difficult this is and how difficult it is to simplify it. So your approach involves something called the MQ6 menopausal assessment tool. So let's talk about that first, and then we can move on to the algorithm that you've developed. So what is the MQ6?
So MQ6 stands for Menopause Quick Six. People think it's because I speak quickly, which is true, but it's actually that it's a quick assessment tool. It's 6 questions, a little bit of the background. I looked to a deep dive looking at the various recommendations, the various guidelines, really around the world, looked at what are the questions that everybody agrees we should ask, what are the typical, most common symptoms that menopausal women present with, and what of those symptoms are the ones that we have treatments for. And then I looked at, well, but we have assessment tools already. Why create a new one? My bias obviously is primary care, where, as you know, we need to do it quick. We have 15 minutes, not an hour. And we also don't always have quite the same knowledge base as some of the specialists do, or really anybody now after WHI. So I looked at what is it that we need to ask? What are the tools that are out there do? Many of them, they're too long. They're good for research. They're good for specialists, but not for us necessarily. And then
let's talk
okay,
about the Quick Six. What's in the Quick Six?
So in the Quick Six are 6 questions written in lay language and with open-ended questions specifically. So it's meant to be an assessment tool, not for a number, but to get the conversation going, to give the doctor or healthcare provider what they need to know, and to give the patient the opportunity to speak in a more open-ended way. So there are 6 questions. The first one is, when was your final menstrual period? Or the question is, have there been any changes in your period specifically? We want to know if you're pre, peri, or postmenopausal. And it also triggers people to remember to tell us if perhaps they've had some postmenopausal bleeding. A lot of women don't think to mention it to us, and it gets missed. Second question has to do with vasomotor symptoms, any hot flashes or night sweats. Third and fourth questions have to do with GSM. So the third question, are you having any vaginal dryness, any vaginal pain, or sexual concerns? And the fourth one, any issues with your bladder or incontinence? And then the 5th question is, how's your sleep? Open-ended question. 6, how's your mood? Because we know sleep and mood are really prevalent during the transition and menopause.
Okay, so it's a great way for someone who is not as familiar to really have 6 quick questions, as you said, and get a pretty good view of the landscape, ranging from hot flashes to GSM to mood and sleep. So now that you have that, what comes next in terms of treatment assessment based on these questions?
So here becomes a challenge. Now you give the clinician the tool, which enables them to do the assessment. And then now what? What do I do to treat? So when I published the MQ6 in 2017 in Canadian Family Physician Journal, I also created an algorithm. We love algorithms, especially in primary care. It makes things simple for us. So I created an algorithm again using the data that I looked at. It happens to be another 6 steps. And the algorithm just basically takes you through the following. Is menopause hormone therapy indicated? And if not, there's an arm for what else to look at. Are there contraindications? Are there comorbidities? Has the patient had a hysterectomy? When was their final menstrual period? So we know where they're at in terms of perimenopause or menopause. And do we need to treat GSM? And again, primary care, really any clinician can quickly go through those 6 steps. And based on the algorithm, there'll be a recommendation for treatment.
So now that you've taken the algorithm, the questions to the algorithm, like a flow chart to help us make these decisions, you've now turned this into an online tool and a website that can easily be accessed. So tell us a little bit about that and what the content is like on the website.
Very excited to talk about that. So I first have to start by thanking the Canadian Menopause Society for supporting me to create this online tool and this website. It is intended to support our healthcare providers, but it also has an arm with information for women. I'll start with that. So there's some general information about menopause. There's some resources. And then the MQ6 tool is on their side as well as a PDF. So it's a fillable tool. It has some hovers to explain the rationale for the questions. And the idea is a woman can go read a bit about menopause. And if she scores even one on the assessment tool, she's got something to talk to her doctor or healthcare provider about. She can print that off, take it to the healthcare provider, and that gets the conversation started. There's also, as I mentioned, some resources on that side. The physician side is much more robust. There's a lot of information about menopause. Of course, there's the MQ6 tool in its original form, but there's also a PDF version, which we made binary with yes, no answers to the questions. Right. So it could be fillable online, and they can import that into their EMR. Then there's the algorithm. Now, the algorithm was done in 2017, so it needed a bit of tweaking, a little bit of updating for the most recent guidelines, and also for the most recent products that we have available, which are also listed in a table on the website.
Right. And so which also may vary depending on where you are. For example, in Canada, we have Tibolone. In Europe, there's Tibolone, but the United States don't.
Exactly. So we have this is a Canadian website. So it is based on what's available in Canada. And thank you for clarifying that. So we have that for at least our Canadian physicians. But the algorithm's been updated. So the new image of the algorithm is there. So it can be printed off. It's a PDF because some of my colleagues use the old algorithm and they just keep it on their desk. But the truth is that what everybody really likes is to have an app or the equivalent of an app. So we have taken the algorithm and created an interactive online tool. Functions as an app. The 6 questions, you basically go to the page that says interactive algorithm. There's a start button. It asks the 6 steps to take you through the algorithm. It's yes, no. It allows you to individualize care. At the end of the 6 steps, you'll get the equivalent of a card that says, we recommend the following treatments. And then there are some rationale as to why, some other considerations. And then there's a link to take you to the hormone tables. And
so before we do that, what was the website called so that people can take a look at it either on their desktop or create a shortcut on their desktop if it's something that they want to access frequently?
Exactly. So it's mq6.ca. And on the website where the interactive algorithm is, there are instructions how to bookmark and specifically how to create shortcuts. So it's on the phone or on the desktop. And there's also another tool there for counseling, because my primary care peeps in particular will say, okay, I don't know what to do. I'm overwhelmed. There seems to be so many decisions on what to treat. And if they get that far, then they're, okay, what do I tell the patient now? So there's a counseling tool there as well that also can be fillable and imported.
It's a really basic approach that's very helpful, because even if you don't have a patient, it's really useful to go onto the site and go through the different arms, because then it becomes a really great educational tool for some menopause 101 and 102, if you will, in terms of how do I identify, how do I define, what are the options to treat, and information about these specific options.
Absolutely. And that is actually the intention of the site, is really to make it simple, to make it educational, and to fill in those knowledge gaps. Because particularly in primary care, I see our residents coming out, they can finish their education having never prescribed hormone therapy, never even seen a preceptor do it. And so they are anxious to learn, but the resources aren't there. So I'm really hoping this will be an easy, navigatable resource for them.
And as always, there's the caveat that while this is a tool that's useful, ultimately the prescribing decision lies with the prescriber. And that ultimately is where we have to make that decision using the tool.
Absolutely. It's clinical acumen. It has to come first. And always, this is really for informational and educational purposes. We always, we have a disclaimer, you really have to practice within your knowledge base, but we hope that this will provide some support. And it is evidence-based. We did have a number of specialists actually be content reviewers. So it's kind of like a peer-reviewed website in a way. So
Wow.
we're confident that the knowledge and what we're imparting is accurate as of today.
Terrific. Well, thank you so much. So again, that's mq6.ca. Okay, take a look at it because it's really helpful. Congratulations on all your hard work and research. Nice to see you, Susan.
And you, thank you very much.